Hi everybody, this is Janae Cherie. Welcome to my channel. It is Friday, April 1st, or April Fool's Day. And I realize this video is certainly not going to go live for a couple more days. It has unfortunately not been a very fun April Fool's Day to me, and nothing in this video is a joke. So, I got my oncology report back. I got to talk to the oncologist this morning, and one of the things we've been hoping for with the double mastectomy is avoiding chemo and radiation. And so part of the surgery is they pulled out lymph nodes. They pulled out 4 to be exact to see if the cancer had spread. And ding, 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 lucky Janae, I have cancer in 2 of the 4 lymph nodes. It could be worse. Having less than 4 lymph nodes infected with cancer is normally a very positive thing, according to my oncologist. But what happens is that when you test positive for cancer in the lymph nodes, they send your tissue for further testing, what's called an Oncotype test. But they look at a variety of different factors, one of them being, is the cancer estrogen positive, which we know that mine is. Is it HERS2 positive, which is a type of cancer that is very, very aggressive, which mine is not, and a variety of other factors that they look at that I frankly don't fully understand. Disclaimer, everybody, I'm not a doctor. Uh, but all these things combined, they come back with a score. So my Oncotype score was 36, which is bad, and means that I'm very high risk for recurrence of cancer in the next 10 years, which is not a long time, frankly. So high level of recurrence in the next 10 years. And essentially anything over a 25 is considered high risk for recurrence, particularly in a premenopausal young person. And so, lucky me, the recommendation for that is to do chemotherapy and hormone therapy to make sure that the cancer does not come back, which is very much what I was hoping to avoid by doing the double mastectomy. So it's been kind of an emotional day as a result, I'm not going to lie. So what are next steps? So assuming I move forward, which I'm probably going to move forward because logically that makes sense to do as well. They are recommending chemotherapy, which is a 20-week regimen. It's chemo for the first 8 weeks every other week, so 4 sessions in 8 weeks. And then the following 12 weeks is weekly sessions. And you go in and they're 3.5-hour sessions and voila. And then I guess there's a hormone therapy that I'm not sure if it's happening concurrently or afterwards to also help to manage that as well. We did talk about some of the side effects and some of the primary side effects, and of course there's a million listed side effects, but the primary side effects for chemo is there is nausea, fatigue, and vomiting. Hair loss is a big one, as well as 2% of people have heart effects and weakens your heart. And then, of course, the benefits of chemo are that the likelihood of recurrence after chemo is much, much, much lower than what my Oncotype tells us is the likelihood of recurrence. So there you go. One of the other concerning issues is related to fertility in terms of chemo side effects. Fertility can apparently cause you to go into menopause, which is counterproductive when I am trying to have a baby in the next 2 years. Menopause would not be very helpful to that endeavor. So they are going to be referring me to a fertility specialist to talk about options. So apparently there's some kind of injection or medication process that you can use to help protect your ovaries during this treatment, the chemo treatment. There's also the possibility of doing egg removal and freezing your eggs for future use. So I have not talked to the fertility specialist yet at all, so I have no idea what that looks like, what that means. But that is another phone call coming up. But talking to the fertility specialist will help to understand options and help protect fertility, or at least the ability to reproduce later. So what I thought was really interesting is that for those of us like me who do not like the idea of losing our hair during chemo treatment, is they actually have a new scalp cooling treatment called Paxman, Paxman scalp cooling treatment that you can purchase. It is unfortunately not covered by health insurance, at least from my medical benefits company. But what it does is you put it on your head and it cools your scalp down, which reduces blood flow to the area during your chemo treatment. And by doing that, by reducing the blood flow to your scalp, what it can do is reduces the likelihood that the chemotherapy chemicals are circulated to that tissue, and you are less likely to lose your hair. Now, it's not a guarantee. She said that 2/3 of people who use the Paxman scalp cooling treatment during their chemotherapy keep their hair, but that still means 1/3 of patients do still lose their hair despite the treatment. But it is nice to have some kind of options in that regard, because losing your hair just doesn't sound like fun. And then of course regrowing it after, if you regrow it after, it's always problematic as well. So that's very interesting. So what are the other next steps? Assuming I move forward with chemo as the plan, one of the things I'll be doing is putting a port in the neck under the collarbone with the goal that they can inject the chemo drugs directly into the neck area so that you don't have to do IVs every single time. I guess it makes it a little less invasive. You don't have to do an IV every time you come to the doctor's office. I guess probably, and I didn't even think about that while she was explaining, but makes sense you'd have less healing to deal with if you don't always have puncture marks in your body. They're also setting up a PET scan, which stands for positron emission tomography scan. So and what that does is it's checking the rest of the body for cancer to see if there's any existing cancer elsewhere that we haven't identified yet. And that's happening regardless of the decision to move forward with chemo or not. And then there's an echocardiogram, which is basically an ultrasound of the heart that's going to be happening to make sure the heart is healthy and happy before moving forward, because there is potential for heart impact with the chemotherapy. So lots going on. Lots of decisions, lots of discussions, lots of appointments, lots of reasons to do videos, to talk to you people. So I will try to record a quick update every step of the way so you understand kind of what I'm dealing with, and hopefully these conversations will help you in understanding from your doctor what has to happen in your own situation, if it's similar, or at least prompt kind of those conversations so that you'll know kind of what to think about, what to ask if I've already done it. And if you have some suggestions for me about what questions I should be asking, or did I miss something in this whole crazy conversation? I do write lots of notes during these discussions, but we all miss things when we're dealing with stressful situations. So please put it in the comments. I do read all of the comments. Granted, I'm not terribly popular yet, so that is not that hard to do at the moment, but I do appreciate those of you who are checking out my videos, and I hope that these have been helpful for you. Thank you all for joining today. As always, I'm here to tell my stories, and I wish you health and happiness and the strength to become a survivor.